Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, ciliary staphyloma. In ciliary staphyloma, so this ciliary staphyloma, actually ciliary body goes into the staphylomatous portion. So this is the ciliary staphyloma, where this is the ciliary body with pars plana and pars pliccata. This is going into the herniated portion. So this is the ciliary staphyloma. Then we have the causes of the ciliary staphyloma are: it can occur due to scleritis, trauma, developmental glaucoma, end stage primary and secondary glaucoma. Scleritis, trauma, developmental glaucoma, end stage primary and secondary glaucoma will result in ciliary staphyloma.
thank you and thank you for watching.